We have Berta with us today, this evening. Berta is 58 years old. She's been a patient of mine for almost 10 years and has been on testosterone replacement a couple of times. We'll just mention that we started in March of 2002 and she responded, except that the dosage at that time was too high and she had an excessive response. So she was off it then for 5 years. Started again in August of 2005, and then we both decided to stop it because her blood level was too high. And then we got the right dose starting in March of 2006, which is a small dose compared to the beginning, and then things took off from there. So let's go back in time and tell us what you were like before you had any testosterone at all.
Okay, before I had any testosterone at all, I was extremely irritable, very depressed, and my sexual desire was like zero. I had no desire for intimacy.
How long had that been going on?
That had been going on quite a while, and I really feel at some point that I was somewhat in denial. I just didn't understand what was going on with me, and I contributed a lot of this to, I said, well, maybe it's just all part of menopause, pre-menopause that I was going through.
Well, by quite a while. Do you mean a couple of years or 10 years or how long?
A long time.
Long time.
A long time.
Depressed, irritable, fatigued, poor libido. You also, before we were discussing this, you used the word timid. You think you were timid?
Yeah, it was to a point where I actually had fear of having any type of intimacy in my relationship, and it's a relationship that I've been in an extremely long time.
Yeah.
And I just didn't understand what was going on with me.
You also used the term that you had a horrible temperament?
Yes, extremely horrible temperament. I mean, I could wake up in the morning and I was like growling, you know. The least little thing someone would say, it would just set me off. I just read into every little thing someone said.
And again, this had been going on for quite a while.
Yes.
Okay, so then we started you on a good dose of testosterone in March of 2006, which is almost 3 years ago. And what's happened?
Well, gradually I started seeing changes. My temperament started improving. Things that would upset me no longer upset me the same way. I had like control over the situation. I was able to think things out more rationally. And the depression started going away. I actually started to like myself again.
Almost everybody who narrates their story tells about an increase in the self-confidence and an increase in self-esteem.
Yes, and that's
very
something,
common phenomenon.
Yes, that's something I always had. And I just couldn't understand. It was just disappearing. I'm saying, what's going on with my life? You know, I just didn't know where to turn. I didn't know what to do.
What about the sexual part of it?
The sexual part of it, the desire started coming back. I mean, even to the point that I found myself going back to Victoria's Secret and, you know, just doing little things to just jazzy up the relationship.
You had also said something about that the way people react to you or respond to you is different than before.
Wow, it blows my mind. It's like when I see people, they greet me, good morning, how you doing, have a nice day. And something that really had me taken aback was this gentleman that I know. He said to me one evening, he says, what are you doing different with your skin? Your skin looks so different. I says, what are you talking about? He says, your skin looks so youthful. I said, well, what are you trying to say? I'm old? He laughed. He says, no. He says, but your skin really looks great. And I said, thank you. You know, and I thought about it. I says, whoa, I didn't change any products or anything, you know, that I was using. I can only contribute to the testosterone.
Yes, that is a very, very common effect. People start to look younger and their skin looks younger. The whole body gets younger.
Yeah.
It's a wonderful thing. Okay, well, I thank you very much for your story. I'm sure people are going to find it very interesting and helpful, and we're going to try to get everybody to become like you.
All right. Thank you, Dr. Gordon.
Thank you. We have today Dr. Tom. Dr. Tom is 61 years old, been a patient for 11 years, and he started on testosterone replacement therapy in March of 2006, which is close to 3 years ago. So what were the problems before we started testosterone replacement?
I experienced some fatigue. I experienced a lack of energy. I experienced actually a lot of sleeplessness at the time.
From anxiety, was that, do you think?
Probably anxiety or thoughts running through your head. I had some mild depression. I don't think I was thinking as clearly as I am now. And I was concerned about my diabetes condition.
Also, what about your libido at that time?
Oh, the libido was probably, I would say, non-existent at the time. It was take it or leave it. Wasn't a major concern at the time, but now that it's totally reversed.
We'll get to that.
We'll get to that.
And you're a type 2 diabetic.
I am a type 2 diabetic.
So your diabetes began at the age of 40.
Correct.
And of course, it's my conviction that every type 2 diabetic is deficient in testosterone. I think that will ultimately be proven to be the case. You were not well controlled when we started. You were not really poorly controlled. Your glycohemoglobins, for those who want to know, have always been in the low 7s. So it's not terrible control, but not what we would call good control. So then we started you on testosterone in March of '06. And what happened then?
It took a while for some benefits to occur.
How long?
It took about a period of about 4 months before I noticed some changes. The libido got better. But I really didn't believe it at the time, so I went off testosterone therapy for a
Well,
short
besides the
time.
libido getting better before you interrupted the therapy, what about your mood swings, your depression, your anxiety, your energy?
I didn't notice a significant change in the energy levels at that time, and I didn't notice a difference in the depression status either. So I came to you and I said, well, I didn't tell you, but I just stopped therapy for a little while.
Okay, and what happened?
And then I realized my libido was less. So I mentioned that to you, and you said, of course, you haven't been here and had your testosterone, and your testosterones are low. So I believed you, and I went back on therapy, and I was a good boy since then.
And what's happened?
And my libido's through the roof. My positive outlook is fantastic, even though the economic times don't call for that. What else? I have a good energy. I don't need as much sleep.
The depression and anxiety?
Depression and anxiety is non-existent now.
Non-existent. So with a regular dosage regimen, everything that was wrong just turned around and went away, basically.
Yes, that's correct.
So a very positive effect. But not so on the diabetes.
Well, that's because I'm supposed to be diet controlled, and I don't do that too well. So we made a deal that come January, if I don't lose 20 pounds off my weight, you're going to start me on insulin. I'm not too thrilled.
Which I've been telling you need for how long?
Telling me for quite a few years.
Okay.
I've just been pushing it off.
Testosterone replacement definitely helps diabetes, but only to a certain degree. All the other factors to control diabetes have to be done also. Okay, so anyway, I'm very glad to see you so perky and horny. That's how we all want to be.
Okay.
And
so when I'm on YouTube, the world's going to know that Dr. Tom is horny. Well, that's very good.
well, you
Barry.
said so.
Okay.
Okay,
All right,
thank you very much.
much. Thank you.
Okay.